Knock, knock. Now wash my hands. Good morning, Tina.
Good morning.
Hello, Tina. My name is Camilo Dilavet. I'm the treating physiotherapy today. How are you?
Good to see you.
Good to see you, Tina. Do you mind if I have a seat here?
Go for it.
Thank you. Tina, as I told you, I'm the physio and I want to know that I'm with the right patient. Would you mind telling me, please, your full name and date of birth and age, please?
I'm Tina, pain in the arse.
Mm-hmm.
I'm 32 years old. And date of birth is 12th of June in something.
All right. Good. Thanks for sharing that, Tina. As you can see here, this is an exam situation for me. Well, you will see my assessor exam Y. They will be assessing me. Is that all right for you? Good. Thanks, Tina.
The more the
So,
merrier.
have you ever been in physio before?
Yes, I had lots of
A
physio.
lot of physio.
Yes, I
Let
had
me
lots.
just quickly brief how my session is going to look like. First part is going to be me asking you a lot of questions. Then will be some hands-on assessment, and we will be planning goals together. And then on the third part, we will be doing some exercises. How does it sound to you?
Good.
Sounds good?
I've been through that
All
before.
right. If anything comes up that you don't know or you don't understand, please let me know. All right? Good, Tina. So I got here a very few information of your illness. So I know that you had a stroke. So would you mind telling me more a little bit about it? When did it happen? Did it happen?
So what I remember or what I was told is
Yeah.
I fell off a ladder.
Yeah, you fell off a ladder.
And apparently I fell on the back of my head.
So you know what day is today? Where are we now? Sorry for interrupting you, but
Yes, it is Monday the 14th of October.
all right.
And
And
it's
where are we
morning,
now?
still no, morning.
Where are we now?
Hospital, aren't we?
All right. Yeah, probably outpatient setting, but that's fine.
Oh, okay. Yeah,
Thanks.
but in the
So-
hospital.
Yeah. All right. So Tina, when did all of this happen?
I can't really remember. So what I remember is that I fell off the ladder.
But did it happen
At
like 4 years ago?
No,
1 year
just
ago?
recently.
How
Yeah.
how long? 3 months? A month? 1 week?
3 months ago.
3 months ago.
3
All
months,
right.
Yeah.
Thanks for sharing that.
Sorry, yeah, I just had to think there.
That's okay.
3 months ago, yes, and I fell off a ladder, and
Yeah.
just doing some roofing,
Mm-hmm.
and
Fell off a
fell
ladder.
off a ladder, and then what they told me, I can't remember the whole incident. They told me apparently I fell on the back of my head,
All right.
and I had a bleed.
All right.
Yeah.
All right. So you went to the
Yeah.
hospital. They took exams on you.
And then I was in a coma first, yeah,
Mhm.
and then they, found the bleed on the back of the head.
Do you remember what part of the
I
brain?
was in a coma for a long time, I
But
think 4 weeks.
all right. But do you remember now what part of the brain was involved? Like, did they
The
told
back,
just the back?
that's all I know.
Brain, cerebellum. Did they told something about
What's the
it?
cerebellum? Don't know.
All right.
Don't know,
Not a
so,
problem. This
yeah.
is something that don't need you to remember. It's just me to get me, a few information of what things to expect.
Yeah.
But because I don't have much information, I am going to ask to your neurologist first thing after the session, just to get all the information from your chart to be sure what sort of things are we dealing with. So what brain lobe is involved and what sort of damage did you have back on that opportunity. All right. All right. Is that all right for you?
Yeah,
Because
yeah.
that way I will be able to,
Know a bit more. It makes sense.
Makes sense to you, for
Yeah.
sure. So
Sorry,
Tina,
I can't tell you anymore. I don't,
not a problem. This
so-
is not your fault. It's nobody's fault. I just need to gather all the information, but that's gonna happen on the following session. All right? We're gonna work with what we have now today.
Okay.
So then, how long did you stay at the hospital?
Oh, quite a while. I think they told me I've been in the coma for 4 weeks. Yeah.
And
then they started doing therapy with me.
all right. So
Yeah,
how long did you
so,
stay at the hospital?
I don't know. I just returned.
All right. So you just returned
Yeah,
last week.
4 weeks in hospital. Yeah. Just.
So you spent 1 week at the hospital, probably a week.
Let's work this out. 3 months ago, I fell. Right. I fell off the ladder. 4 weeks I was in a coma, and then so at least they've done a month rehab with me.
All right.
There. So yeah, let's say I've been home now for.
All right. So how was your mobility as soon as you get out of the were discharged?
And home, yeah. So I can get out of bed with assistance. Right?
Assistance of
one.
One person.
So
and is that
and
your
then
mom?
At home.
Is that your mom that's
yes,
helping you?
Yes, it's my mom. My mom, my darling angel. Yes.
All right.
Yeah.
So she's helping you out. And is she coping well with that?
Yeah, what mums do. Hey, mums do what mums do, isn't it?
Yeah, for sure. But
she is all right. Yes, I think she is all right. I can do a lot of for myself. Yeah, with the standing, she just has to hold my hand.
Alright, so let's work things out a little bit. So are you able, while you are laying flat on the bed, are you able to roll by yourself?
Yes, I can do that now.
Right to the left as well? To the right and to the left with no problems?
That's what they did at work, yes. In the hospital.
So you are fully independent on that?
Yes, I am.
What about when you do the supine to sitting position?
What's supine?
Supine is like laying down, like laying flat on the bed.
On the back or?
Yeah, on the back or.
Yeah. Okay. So now that's good too. What?
Are you needing assistance of somebody?
No.
So you are able to do
bed
it.
And sit in bed. Everything is okay. What my problem is sit to stand, right?
Sit to stand.
From right. Sitting to standing.
All
That's
right.
my problem. This is where I need my mum.
Are you able to sit by yourself with no assistance?
Yeah.
Yeah. All right.
Yes.
Are
I
you
have
able
to hold on to
your balance?
I have to hold on the side of the bed.
All right. Yeah. And are you able to hold your balance by yourself, or you need somebody that holds you?
No.
Okay. So then, from sitting to standing, what sort of assistance do you need from your mom?
Yeah, she needs to give me a bit of a push.
All right, a push.
Yeah.
All right.
Just to, so.
All right. And
when she says, Tina, stand up, I can't. So I need to hold on. I need to hold on to her.
All right. Fair enough. And while you are standing there, are you needing assistance or supervision?
Yeah, mom has to hold my hand.
Hold your hand.
My mom has to hold my hand. Yes.
All right, but not physical assistance, meaning holding your weight or stuff like that.
No, she holds my hand.
Just holds your hand, like.
Yeah, she's supporting my arm.
Your left arm. All right.
Yes.
And I know I got from your chart, your notes, that you work with an assistive device. What sort of assistive device is it?
My mom.
No assistive device?
No.
Okay. So your mom helps you?
Yes.
Holding your left arm?
When you say assistive device, what do you mean? Like a walking aid?
Like a walking aid?
No,
like a
it's mom.
4-wheel walker or stuff like that?
No, I don't have any.
All right.
I don't know where this comes from.
All right. And are you able to walk by yourself and your mom holding your arm, or?
Yeah. She holds on to my arm.
All right, but just your arm, just holding your arm. But apart from that, are you able to walk, keep one step after another step?
Yeah, it's a bit of a challenge with the left side, as I'm walking a bit funny there because I feel, I can't lift my
For sure.
foot.
But are you able to bear weight on that leg?
Yeah. Otherwise I wouldn't be able to walk, would I?
For sure. That's what I am asking you, just to make sure we are pointing in the right direction, as I don't have much information, Tina. All right. So thanks for sharing that with me. And how about your daily activities, like getting dressed and toileting,
Yeah, I try to
showering.
do everything, you know.
But are you able
But
to?
yeah, as I said, because you know, once I'm sitting, I'm okay.
Mhm.
Yeah, once I'm sitting, I'm okay. But
I,
it's just to get into the shower.
I just want to
I
make sure you got an OT assessment
I think the
at your
OT
house.
was there. Yes, yes, he did. You know, OT was there in the house.
And
You know,
he
so
assessed the safety, the
yeah,
safeness
yeah,
of your house.
yeah. I've got the rails there and
Beautiful. Then I'm
everything.
happy with it. So,
Mm-mm.
what about your house setting? Is it a a single story house,
Yeah,
double
it's single
story?
story. It's single story, but I've got there's steps, you know, to get in and out.
All right.
Yes.
And how are you navigating them?
Yeah, mum has to help me, you know. So,
All right. But you
I
got
don't.
rails.
No. Oh yeah,
The
no, of course,
LT.
yeah, the OT did
All
the
right.
rights there.
All right. So did the rails. And
Mm-hmm.
are you struggling to navigate those steps to get in and out of your house? Or are you okay at the moment?
No, mum and we stay inside the house. We don't go. I don't go out.
You don't
Mum,
go
mum,
outside.
mum does all the shopping for me.
So
You
you are
know
not
what I
able to
mean?
go out so far.
No.
Okay, that's okay. So Tina, yeah, you walk with your mom, and how far can you walk within your house?
In the house, 30 meters max.
And she's
Yeah.
always next to you, or are you able to walk just by
No.
yourself?
You know, she needs to be, you know, otherwise, sorry, you know,
All right. How is your balance?
no good.
No worries, Tina. Thanks for sharing that.
Mm.
So, coming a little bit back before this accident, you were on the roof, you know. So, what sort of things were you able to do? Were you fully independent?
Yeah, I had a good time.
For
you
sure.
know,
And
so I like to socialize with my friends. And
sure. What do you have any job? Do you work?
yes, yeah, it happened on my job, right? You know,
Alright.
when I fell off the, you know,
Alright. What sort of
you know,
job do you
roofer,
do?
I think I am, you know,
Alright.
so you know, have to go up ladders and,
Alright.
you know, but I'm an apprentice.
You're
Right,
an
I
apprentice.
changed, yes, I changed jobs. But anyway, this is what I want to do.
And you're in a sick leave now. Are you all
Can you
covered?
see me? Can you see me walking up and
No,
down?
for sure. I was asking if you are covered by health insurance or any.
Yeah, I have sick leave.
All right, and you okay with that?
Yeah, well, you know, so because I've been off work now for 3 months,
Mhm.
you only have that much sick leave, right?
Yeah, for sure. That's
So
what I'm
you
asking.
know, so no, I don't have private health cover. Or
But
I'm a bit
so far,
worried, you know, because
So-
I have a son as well.
okay.
Yeah.
But so far, how are you coping with it? Do you find yourself like need some sort
We're
of
struggling.
assistance?
We're struggling because mum is retired, you know, she's
Alright,
on
Tina.
a pension.
And so I
you
will.
know,
I
I'm
will.
divorced, asshole.
Yeah. So I will. I will feel really, really okay trying to encourage you to engage with a social worker, because the social worker will give you the proper assessment and probably
Yeah, I haven't
give.
seen one yet, hey? Can you get that?
Yeah, for
now?
sure.
So
Because that's what I
yeah.
was about to tell you, that the social worker will probably be able to help you on that matters.
Mm.
All right. All right, Tina. So overall, you were pretty active. You work as a roofer apprentice, and now you're not working, obviously. What hobbies do you have?
Catching up with friends, having beers.
All right. Any sports that you like to practice, sort of activities outside?
I like to watch the footy.
Footy.
I,
Watch
uh,
footies.
Mm,
But you like to play it or just watch
No, no, just watching
Alright,
footy,
yeah.
hey, with my
Alright.
friends.
it? And what about, yeah, probably that's some sort of stuff that you would like to get back to. But do you smoke, if you don't mind me asking?
No.
And do you drink alcohol? Yes, but how very often?
Oh, well, you know, in footy season, you know, so when we get together, we can, yeah.
All right. And how much would you say it is?
Oh, we can get through a carton, eh?
Mm-hmm.
Mm.
All right. So
What,
that's
how many beers is that?
what would
4 6 packs, you know?
in one night. So that's a little bit on the high end, Tina.
Man, you're Aussie.
Yeah,
Yeah.
for sure. But I'm pretty sure in this journey that you have been somebody have told you about the benefits of reducing the
Don't
alcohol
go
intake?
even there. You know, they're so smart.
Yeah, for sure, Tina. But this is my duty of care with you to tell you and let you know that, especially with brain things and brain issues, and because you had a brain injury back in, back in the day, so it's highly recommended for you to get a better health,
Yeah, well, I
overall
was in
health.
hospital, you know, I couldn't drink anyway.
For sure. And
I
how
would
did you do
think
it?
about it.
Hmm. So you will think about reducing the alcohol
Yeah, I
intake.
would think about it.
All right, fair enough. That's at least something, Tina. So
My
good on
friends,
you.
well, it's now footy season right now, so footy season is finished. So,
All right, because there is a lot of help available, Tina. Maybe at the
I'm
end
not
of
an
the se-
alcoholic.
No, no, I'm not
I
saying
just
that.
don't even drink.
Don't
I'm
take
an
me
Aussie.
wrong. Don't take me wrong. I'm just telling you what the benefits are of reducing the alcohol intake, especially to get you back to your full.
Don't bother. I will think about it.
That's all right. Thanks, Tina. Thanks for that. Um, so before we can go ahead, I would like to dig in a few conditions that will require further assessment. So, have you ever experienced any headaches,
Mm-mm.
unremitting headaches,
Mm-mm.
problems with your visual field?
Yeah.
What sort of
No,
problems?
sometimes I feel I can't see properly.
All right, but
so
did the
my mum said
neurologist?
to me that, so when she stands sometimes on my left side, I need help with my
All
left
right.
side, then.
So you can't see properly your left side?
Yes, so she says sometimes I don't see my mum very
But,
well, right?
Did this happen after the fall?
Yeah.
Okay.
You were talking before?
No, I'm talking about now.
Yeah, so, yeah.
All right.
Just,
And what about
hitting the head
smelling
again.
problems, or tasting problems, or hearing problems? No?
No.
Swallowing
It's more the-
problems?
No.
Any problems articulating your words?
What do you think?
I think you don't have any problems, but have you experienced any?
In the beginning, after the coma, everything was just...
No, but now any sudden problem with your articulating of your voice or getting choked?
No.
Okay. Any chest pain or unremitting pain in any side of your body? Cough, chills, night fever, sweats? No? Cool. And what about bowel and bladder problems, issues?
Yeah, in the beginning, I pissed in my pants.
But now it's getting better? Are you still using nappies?
No.
No? Because you told me about nappies, so
Yeah.
I wanted to know if are you still having
No,
some
it's not good.
accidents?
No.
All
I
right.
don't have accidents.
That's okay. And what about any sudden weakness in any side of your body after this stroke? I know that your left side is not working properly, but have you ever experienced any new onset of this weakness, sudden weakness, or sudden problem with your sensation?
No.
No? Okay. Cool. So,
Weakness? Yeah. What do you mean weakness? So I feel
So
weak
how is your
overall.
left side?
Left side is
Is weak, yeah? That's weakness.
Yeah.
so have you ever
Okay.
experienced any other new onset of weakness?
No.
No? Cool. Great. So, Tina, what do you expect from today's session?
Oh, I had a lot of physio. My gait is, I walk like, people can see that that I had an injury, and I would like to, I'm young, so I would like to go back to work in the long term, and then
For
I would
sure.
like to walk better.
For sure. So we can
So-
put that, Tina, as a long-term goal for sure. And I'm
Look
gonna try
better.
to make sure that we can that we keep that goal as our long-term goal. But what are you expecting just from today's session?
Yeah, just work on my left side, mate.
All right.
So that's, my balance maybe, so I'm a bit scared of falling.
All right, so
Or,
maybe
you know.
gain a little bit of confidence would
Yeah.
something that you could consider.
Yeah.
How about pain? Are you experiencing any pain in any side of your body? No, not even in the shoulder. All right, cool. Thanks. So Tina, I think that I got the big hints of what are we gonna do today. I would like to go on my hands-on assessment. So it's good to you.
Yep.
Sure. So you told me that your left side, I'm gonna just stand behind you. Your left side, you cannot see properly. Is that correct?
Yeah, my mum said something.
All right.
You know, and
So-
sometimes I just can't see my mum.
For sure. Look straight ahead of you and let me know on the right when you can see my finger.
Yep.
All right.
Yep.
Cool. Now let's go to the left side.
Yeah.
There?
Mm.
All right. Can you please follow with your eyes my finger? Follow my finger with your eyes. No head movement, all right? Good job. Now keep focusing in my finger and move your head towards the left and towards the right. Now look at the left. Look up, move your head up, tilt your head back, and tilt your head forward for me. Good job. Any problems with that? Blurred
Heart.
vision,
No.
blurred vision, double vision, no?
No.
All right. Can you hear me?
Yeah.
Which side? All right, and tilt the same. Did you hear the same?
Yeah.
All right. Close your eye. Oh, sorry. Close your eye for me, please. And let me know if do you feel this?
Yeah.
Does it feel the same?
No.
No. Do you feel this?
Yeah.
Does it feel the same?
Bit less, eh?
Bit less. How much would you say? 70%, 10%?
No. 10 to 20%
Less.
less.
So it's like an 80% of feeling on that side.
Yeah. I was never good in math, but it's not much, right?
You don't feel much?
No, it's not much difference.
Alright,
It's not
so
much
it's
different.
pretty much different, pretty much equal, pretty
It's-
much the same.
Yeah,
Just a little bit less.
little bit less.
Alright.
Yeah.
So, do you feel this?
Mm-hmm.
And what about here?
Mm.
Feel the same?
Mm.
Feels the same?
No, less.
Less. So 10%
This-
left.
Yeah.
All
10,
right.
20%.
10, 20% left. Feel the same?
Mm.
What about here? Feels the same?
No, it's just less.
Less on the all the way up. Alright, that's okay.
The whole-
Open your eyes please for me.
Left eyes.
Open your
Left
eyes.
side's fucked up.
Alright. So, now, I'm gonna move your thumb up and down, and I want you to let me if it's up or down.
Mhm.
Alright? Close your eyes again for me. Up or
Up.
down?
Down.
Good job.
Up. Down. Down.
Good job. Keep your eyes closed. Up or down?
Up. Down. Down.
Good job.
Up. Down. Up. Up. Up.
Good job. Open your eyes. Thanks for that, Tina. Can you please lift your right arm up toward the ceiling for me, please? Right. Good job. Down. Chicken wing. Yep. Keep it there. Don't let me push you back. Push you back. Good job. Now, press my hand. Press my hand. Squeeze my hand. Right. Now let's go with the left one. Up toward the ceiling. Pretty good job. Alright, chicken wings. Yep, don't let me push you down.
Yeah.
Up, up, up. Are you working with the OT with that shoulder?
Yes,
Good job.
strengthening. They give me so many exercises.
And are you doing them? All right,
No.
push my hand. You're not doing them, but are you still doing some sessions with him?
That's
All right.
enough.
All right, hold my hand tight, squeeze my hand. Good job. Keep doing those exercises because on that way we will prevent your shoulder to stay stiff and also lose the muscles. All right? If you want to get back to your job as apprentice, as a roofer, you will need your left shoulder, so you need to keep working on your left upper leg.
Because
You have to do it.
Yeah.
All right?
I'm left-handed too, eh?
All right. So how are you writing now?
It's no
You
good.
know,
Eh?
so if you don't do the exercises that the OT give you, the improvement is going to be slower. So the better outcome will come as far as you do the exercises and you keep doing your sessions with the OT. All right? Knee up for me, please.
Watch out.
This one.
Knee up. Okay.
Yep, hold it down. Don't let me push it down. Good job. Kick out for me. And let me push it down. Toes up. Toes up. Push my hand. Bend the knee. Good job. And press my hand. Good job. Now, knee up. Don't let me push it down. Up, up, up. Don't let me push it down. Up again. And push my hand. Good job. Kick out for me. Don't let me push it down. Again. Don't let me push it down. Good job. Up. Toes up. One more time, please. And press my hand. Bend the knee. Bend the knee. Good job. All right. All right. Now the last thing, I'm not expecting any problem with your coordination, so I will like just to quickly assess that. All right. So touch my finger with your finger, and then touch your nose, and make it as fast as you can. Fast, 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 fast. Faster, faster, faster. Good job. Beautiful. Now we're going to do some tests with the left lower leg. So I want you to rub with your heel, rub your shin. All right? Make it fast, please. All right. Good job. That's enough for me. Good job. Great. So now I'm going to ask you to stand up. You are in a wheelchair now, or are you on a regular chair?
No, wheelchair.
Wheelchair. All right. So because this is my first time with you, I'm gonna take you this pelican belt, and I'm going to wrap you around just to be on the safe end. All right. This is my first time with you. So and because there is no mom, I would like to ask my assessor to stand on your right. I will be standing on your left. Okay? So, stand up for me, please. And show me how you do it.
You need
One.
to give me a bit of a push, alright?
You can do it by yourself. I'm pretty sure. One. Yeah. You see, you made it by yourself. How are you feeling there?
Okay.
Are you able to hold on that position? Okay, go back to the chair, sit down. So, first thing first. I know this is hard for you and you usually require assistance of one to stand up, but I want to teach you one way to do it with no assistance. Alright? So, rock you forward, scoop you forward, 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 forward. Alright, so first thing, your heels, your ankles has to be a little bit behind your knee. Ankles a little bit behind your knee. You know? Can you see they are a little bit behind? So then you're going to start to rock you back and forth 3 times. 1, 2, 3, and on the count of 4 you're gonna stand up. Alright? Try to put weight on the left and on the right as well. Alright? I'm gonna be here with you. Alright? So you can put your arm there or hold on to the armchair as well. So 1, 2, 3, and the count of 4. Alright.
It's better if I use my arms.
For sure. That's gonna be way better for you. So I'm glad you're not needing any sort of support here. So can you please put weight on the right and then on the left, right, and left. Alright. Can you lift that knee for me up, please? Up, up, up. Good job. Change the other side. Beautiful. Good. So 2 steps to the left. Sorry. 2 steps to the left. 1, 2, and then 2 steps to the right. 2. Beautiful. Keep your feet apart a little bit. You're able to hold that position with no problem. So put your feet together now for me, please. Really together, really close. Yep. And I'm going to time how long can you stay there. 1, 2, 3, 4, 5, 6, 7, 8. 8 seconds. Alright. Now put your left leg forward a little bit. Yep. And keep that position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, let's say 20 seconds. Back. Then the right one forward. Stay there. 1 minute. Stay there. 2, 3, 4. Alright, let's say 5 seconds.
Left leg not working.
It's not working properly. Alright. Now, the left leg is going to be just in front of this one. Hold on to my hands. Left leg in front of the right one.
Ooh.
Yeah, it's going to be really difficult. So, when you feel alright, you can 1, 2, 3, 4, 5, 6, 7. Alright. Change your legs now. The right one is going to be in front of the left. Hold on to my hand. Hold on to my hand. Wait. Alright. You will do it, but if it's only 1 second, that's fine. Alright? Alright. Now, go back. Go back. We'll try, but you're too unstable to release you, so we're going to just take that time. Alright? Alright, fair enough. Now, let's go to that chair that I've already put here. Come back to that chair, please. Let's go to that chair. Alright. Go to that chair, please. Supposedly, if you are in a wheelchair, I will put you back in the wheelchair and I will wheel you to the gym area. So we are back in the gym area. You're in a chair there. Can you see the 3 meters mark here? Alright. Are you able to walk by yourself to the 3 meter mark and then come back and have a seat?
Usually mom walks with me.
Alright. Alright. Let's try to do one trial. Alright, so stand up for me.
Okay.
Remember the things that I told you?
Yeah.
Alright, you did it way better now. So try to walk with me. Try to walk with me. Alright, go back. Come on. Alright, come back to the chair. Yeah. You feel safe? I'm happy, you can do it. I'm just gonna be standing close to you. Okay? You are using your pelican belt. Go back. Sit down, sit down. Alright. So basically what we are going to do now is that my assistant is going to be on your right, I'm going to be on your left, and we are going to be really close to you, not touching you. Alright? So be reassured, you are not going to fall, we're going to be there for you.
Okay.
First thing. Second thing is when I say go, you're going to stand up, walk as fast as you can in a safe pace, get to the 3 meter mark, turn around, walk back, turn around, and have a seat, and I'm going to stop the timer. Alright?
And you're going to be with me, eh?
I'm going to be with you the whole time.
Okay.
Alright? So, are you ready?
Mm-hmm.
1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, and 9, 9. All right, good job. How are you feeling, Tina?
Oh,
That was a bit of a work there.
Yeah,
it was.
I don't feel safe,
For sure,
walking,
must to be really scared. Don't feel your left leg properly. Has to be really scary. But there is really good news for you. The first thing is that I catch a lot of things that we can improve, and your left leg is supporting your weight, which is great. All right. So first thing first, the test what we have done now took you 25 seconds. So everything that goes over 13.5 or 14 puts you in a high risk of fall. So because of that, we are gonna keep working with you. All right. There is an option of assistive devices for you, but at this stage that we still are in the subacute phase, we still have a couple of months to improve. So I don't want to put you on any assistive device because that will slow you down.
Will I get like this?
With your hand? Are you doing the exercises? What do you think? All right, Tina, so if you keep doing your exercises, if you still going to the occupational therapist, your rehabilitation will be better.
Yeah.
All right, so if you are concerned of your arm, my strong advice is that you have to keep working on that arm.
Yeah.
All right?
And my leg.
And your leg is going to be the same. So,
yeah.
I'm going to just start talking about you that because you are dragging your foot. You see, when you are walking, your foot is dragging. You're dragging the foot, and you are missing. I know that's something that happened after the strokes. So the good news is that you are young, you are healthy, no medical conditions, no medications from previously. I forgot to ask you probably, but now is probably a good time. Do you have any other medical conditions that you should be aware of?
No.
Taking medications?
It's my family, right? My dad died really, he died a really heart attack, we've got,
And what about medications? You taking any medications? Fair enough. Sort it out. Sorry for missing that.
Yeah, the neurologist gave me something, like
painkillers? Blood thinners?
No, not blood thinners. Because, I don't have high blood pressure, I don't have any, I can't remember now.
That's all right. As I told you, I'm going to ask your neurologist for all your details of your chart and also, the medications and any other medical background that could be important. So I was telling about the gait pattern. First thing, we're going to start working on your toes going up, lifting your toes when you're walking. Makes sense to you?
Yeah.
What is happening is that you are letting your feet get caught on the floor because it's always, pointing down, and I would rather have them pointing up. Makes sense to you? All right, so stand up for me, please. So you're really young, so I'm okay with that. Go. So basically, this is what we're going to do. Up, up, 10 times.
Ooh.
Up. Woo! Beautiful. Up.
What up? Toes
Yep.
up?
Yeah.
Like this? Ah.
Yeah. So it's gonna be heel, heels off, toe off.
Oh, okay.
Alright? Heel slides, toe, heel, heel rises. Sorry, heel rises, toe rises. Heel rises, toe rises.
Okay.
10 times, please. 1. Good job. 2. Yeah. 3. 4. Gonna hold on to you. Up. Alright.
Ooh.
10 times.
I think so.
Alright, so next thing that I want you to do is I'm gonna put a chair in front of you and you can do this at home as well. This is the first exercise that I want you to do at home.
Okay.
Alright? So you are going to do this at home. I'm going to write them down for you and you are going to do it as
I've got
as
tons of exercises.
For sure.
You know,
But this
5
is
or
the
6 pages.
this is going to be the
Yeah.
new exercise program, so you don't need to waste your memory on those.
What? All the others you don't.
All the others. We're going to start over.
Fresh.
Fresh. From
Oh,
fresh. Alright?
okay.
So I want you to focus on these exercises for now. Alright? I'm gonna write them down for you and I'm going to email them for you. Alright?
I feel
So
better anyway. than
in a
the
chair?
other pieces. Are you married?
doesn't matter now. We are in a physio session. So hold on to the chair.
Okay.
Alright? And yeah. Your left knee is gonna go up. Yep, 10 times. 2, 3, 4, 5, 6, 7, 8, 9, and 10. The other one. Yeah, you're gonna get really exhausted, Tina, because you are really young and I want you to get back to your normal life. Second exercise program at home, 10 times.
Okay.
Alright?
How many repetitions?
I'm gonna let you know. So 10 of each. You
Yeah.
remember the first one? 10.
Oh,
And 10.
okay.
Yeah?
Yeah.
Alright? Are you following me?
Yeah.
Cool. So the next thing that I want you to do is start working on your gait pattern. So I want to exaggerate the movement of your left lower leg. What does it mean? I want you to step to do a really good hip flexion, knee extension, and land on your toe.
Okay.
All right?
Yeah.
So that's
I
the
think
first
I've
thing that I
done
want
that.
you to do.
With my left first?
Yeah, just the left, and go back now.
Oh, okay.
10 times. So for this exercise, you are gonna need your mom standing on your left. All right, this is the third exercise, 10 times. Keep going. That's 7. That's 8. That's 9.
Oh.
That's 10. Alrighty. How are you feeling? Feeling okay, Tina? Alright, let's keep pushing because there is only a few minutes left of the session and I need to reassess you. Alright, so first thing, I want to start walking with you and you're going to put in practice what we have learned today. Alright, so first thing, a nice and good hip flexion, land on your heel and then the right leg step through.
Okay.
Alright? 1 and 2. Good job. 1 1, 2. 1 and 2. Come back for me, please. Alright, now when you are at home, I want you to remember these exercises, and I want you to remember how are
Can
you
you write them
walking
down
now.
for me?
Yeah, for sure. That's what I told you.
Okay.
Yeah, I told you. A lot of times. Alright, let's give one more. Alright. So, the next thing that I want you to do is every time that you are walking at home with your mom on your left side, you're gonna turn towards your right. Stop. Yeah. Not more turning over the left, because I don't want your feet to get caught. I want you to start turning over your right. Alright? Alright, so left and right. Left and right. Left and right. And get back to the chair.
Okay, and mum is always on my left side? Or?
Mom is always on your left side.
Okay.
Alright? Alright, how are you feeling? This is the last part. We're going to do the last 3-meter walk test and wrap things up. Go to the you know, the room and wrap things up. Okay? Are you feeling okay?
Yeah,
so we're going to redo the same test, but I want you to introduce all the things that we have learned today.
Okay.
Alright?
Alright.
So are you ready?
Yeah.
Okay. 1, 2, 3. 2, 3, 4, 5, 6, 7.
How was that?
Was way better, Tina. Beautiful. So it took you before 25 seconds and now took you 23. A slight improvement, but the good thing is that your gait pattern seems to be much better. Alright, which is great.
It feels, you know,
At least, if you want to go with me, I'm going to wheel you back to the, you know, the room. And I just want to make sure, how are you feeling now?
Yeah, I feel much better. When can I go back to work?
To work, it's
Yes,
gonna take a little bit more time. So we have to work on, first thing, we have to work on your strength of your lower limb, and you have to keep doing your exercises with your left upper limb. Remember? So roughly the time frames for a stroke patient takes in average 6 months. And those first 6 months we have a lot of improvement. All right, from 6 months to a year, the improvement slows a little bit, and then after a year, the improvement is less likely. But the good thing is that you are young, you are healthy, and you are only 2-3 months after your stroke, and you are already walking by yourself with slight things to improve.
Yeah.
Alright, which is good, but I'm not able at this stage.
And
this is just my first time with you. Alright, so this is just the first session with you, and I'm not able at this stage to let you know how many days or how long it's gonna take. But I trying to make you a picture of how you know what time frames for a stroke looks like. You know what I mean?
Yeah.
So, yeah, probably it's gonna be better if, together with all the inquiries that I'm gonna do with the neurologist, I will ask him as well, you know, about the time frames, and we can get back to you on the second session. All right?
Okay. When are you coming back?
Yeah,
again?
today is Monday, and I want to see you again on Thursday. All right?
Okay. Okay.
Any questions with that?
No.
Remember what we have learned today, and the
Yes.
exercises that I gave you, I'm gonna email them to you. All right?
Thank you.
Cool. Thanks.
Thank you.
I think we are just in time.